Hello everybody, welcome back to my channel. This is Dr. Ipshita. Today we'll be learning 10 points about anatomy of the orbit. Firstly, dimensions. The orbit is a pear-shaped structure. The anterior opening is 4 cm in width and 3.5 cm in height. Dimensions differ, like it is more in males than females, differ between races, like Asians usually have a smaller volume than the Caucasians, and with age, the volume of the orbit generally enlarge. The orbital volume normally is around 30 cc. The orbit is made up of 7 bones. So the above picture is a lateral view and this is an anteromedial view. Now let's see which are the 7 bones. Firstly, the frontal bone here. Then we have maxillary bone, the lacrimal bone, ethmoid, and the sphenoid bone. Here we have the zygomatic bone, and seventh here we can see the palatine bone. This is how it looks in the trans view. Like we said, it is a pear-shaped structure because there's a narrowing at the apex of the orbit. This is the medial wall, the lateral wall, and this is narrow here. So relation of the walls of the orbit, the parallel medial walls are separated by 2.5 cm by the paired ethmoid sinuses in between them. They measure 4.4 to 5 cm on average from the anterior lacrimal crest to the medial optic canal entry ring. The lateral walls, they each form a 45-degree angle to their corresponding medial walls and thus are separated from each other by an approximately 90 degree. The length of the lateral wall from the rim to the superior orbital fissure is about 4 cm. So like we can see here, the medial walls are parallel to each other. The paired ethmoid sinus in between, they're separated by 2.5 cm. The lateral wall is at 45-degree angle to the medial wall, and when we see the one lateral wall from another, it's a 90-degree angle. Now let's take each wall individually. The lateral orbital wall is made up of 3 bones: the frontal bone, the zygomatic bone, and the greater wing of sphenoid. So what else do we need to know that is clinically significant for the lateral wall? The rim is at the level of the equator of the eye. That means it is helping in good peripheral vision, but at the same time, it leaves the temporal aspect of the globe unprotected. Thus, this is vulnerable to trauma. However, the bone is thick and strong in the lateral wall, so fractures are rare here. The orbital floor, this is also made of 3 bones: the palatine, the maxillary, and the orbital plate of the zygomatic bone. So here what's important, the infraorbital canal. It runs under the floor of the orbit. This carries the infraorbital nerves and vessels which may get damaged during damage to the floor. So the floor is susceptible to blowout fractures. When we think of blowout fractures, the next thing that should come to mind is on imaging we get teardrop sign. So the floor forms the roof of the maxillary sinus. The medial wall. The medial wall is made up of 4 bones: the frontal process of maxilla, the lacrimal bone, the ethmoid bone, and the body of the sphenoid bone. Clinically, the ethmoid bone is covered by the lamina papricia. So what happens? This lamina papricia is very thin. So it allows transmission of infection from the ethmoid sinus through the ethmoid foramen. And this ethmoid sinusitis is thus most commonly associated with orbital cellulitis. We need to know about the cribriform plate here, which is at the level of the frontoethmoid suture. So excursion above this level during surgery, it can lead to CSF leak. And we need to know the foramens. The anterior ethmoidal foramen is 24 mm posterior to the anterior lacrimal crest. The posterior ethmoid foramen is 12 mm behind the anterior ethmoidal foramen. And the optic canal is 6 mm behind the posterior ethmoid foramen. Here we can see the anterior, then the posterior ethmoid foramen and the optic canal here. So this is 24 from the lacrimal crest. This is 12 from the anterior, and this is optic canal is 6 from the posterior ethmoid foramen. This 24-12-6 rule is useful while operating on the medial wall of the orbit. Coming to the roof. The roof is made up of the orbital plate of the frontal bone and the lesser wing of sphenoid. So, in orbit, we found both greater wing, lesser wing, and body of the sphenoid in 3 different walls. So, the roof separates the orbit from the frontal lobe of the cerebrum. Structures to note on the roof are the lacrimal gland fossa, which contains orbital lobe of the lacrimal gland. The fossa for the trochlea of the superior orbital tendon. It is 5 mm behind the superior nasal orbital rim. And the supraorbital notch of foramen. This transmits the supraorbital vessel and the supraorbital branch of the frontal nerve. So this is what we need to remember about the anatomy of the orbit. If you like this video, please hit the like button. If you find it useful, share it with your friends and colleagues. And subscribe to my channel. If there are topics you would like me to cover, please leave them in the comment section. Hoping this was useful. Thank you.